Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about diabetic coma. So, if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon, and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Diabetic coma. Diabetic coma is a life-threatening emergency that can affect you. If you have diabetes, in a diabetic coma, you are unconscious and unable to respond to your environment. You are either suffering from high blood glucose hyperglycemia or low blood glucose hypoglycemia. You need immediate medical attention if you go into a diabetic coma. Now, what is a diabetic coma? Diabetic coma is a life-threatening emergency that can happen to you if you have diabetes. In a diabetic coma, you are unconscious and unable to respond to your environment. You are either suffering from high blood glucose hyperglycemia or low blood glucose hypoglycemia. You need immediate medical attention if you go into a diabetic coma. What are the causes of diabetic coma? Diabetic coma is mainly caused by an extremely high or low blood sugar level. One of these conditions is diabetic hypersmolar syndrome. It happens in people with type 2 diabetes. If you develop this condition, your blood sugar could be as high as 600 mg per deciliter. Your urine won't contain ketones usually. Your blood will be much thicker than normal. Another condition is diabetic ketoacidosis, which is more common in people with type 1 diabetes. Things you know about this condition include it could happen with a blood sugar as low as 250 mg per deciliter or even lower in some cases. Your body uses fatty acid instead of glucose for fuel. Ketones develop in your urine and bloodstream. Now, what are the symptoms of diabetic coma? The following symptoms are your body's warning sign that your blood sugar glucose is too high or too low. Whenever you have these symptoms, check your blood sugar. If it is too high or too low, treat it according to your healthcare provider's instruction to prevent a diabetic coma. If you have had diabetes for a long time, you may fall into a coma without showing any of the symptoms. Now, some symptoms of hyperglycemia, which is high blood glucose, are tiredness, abdominal pain, shortness of breath, increased urination, weak pulse, drowsiness. Other symptoms of high blood sugar include walking unsteadily, increased thirst, rapid heart rate, dry mouth, fruity smell to your breath, hunger. Low blood sugar hypoglycemia also has signs and symptoms. These include weakness and tiredness, sweating, fast breathing, shakiness, nervousness and or anxiety, nausea, confusion, and problems communicating, light-headedness, dizziness, hunger. When blood sugar is too low, the brain does not receive enough fuel. This can be caused by drinking too much alcohol, eating too little, exercising too much, taking too much insulin. What are the risk factors for diabetic coma? While anyone who has diabetes is at risk for diabetic coma, the causes depend on the type of diabetes. People with type 1 diabetes have a greater chance of going into a diabetic coma as a result of diabetic ketoacidosis or hyperglycemia. This is because people with type 1 or diabetes always need insulin and have a wider range in their blood glucose level than people with type 2 diabetes. People with type 2 diabetes have a great chance of going into a diabetic coma from diabetic hypersmolar syndrome than from diabetic ketoacidosis or hypoglycemia. Other risks that can lead to diabetic coma in anyone who has diabetes include surgery, trauma, illness, insulin, delivery problems, poor diabetes management, drinking alcohol, skipping doses of insulin, using illegal substances. Now, what are the complications of diabetic coma? Complications of a diabetic coma include permanent brain damage and death. When is it necessary to call a doctor if you have diabetes? Call a healthcare provider in the following situation. If you have diabetes and your blood sugar is 300 mg per deciliter or higher 2 times in a row for an unknown reason. If you have a low blood sugar less than 70 mg per deciliter that has not come up after 3 treatments, call your healthcare provider or 911. If you see a person with diabetes who appears confused, they may be having a low blood sugar episode left untreated. The low blood sugar could lead to a diabetic coma if the person is still able to follow instruction and give him or her something to drink or eat, or call an ambulance for 911. If you see someone with diabetes become unresponsive, call 911. If you do call 911, let the responders know that the person has diabetes. So now, how is diabetic coma treated? If you go into a diabetic coma, you need treatment immediately. You are at risk for brain damage or death if there is any delay in responding. If your blood sugar is too high, you will receive intravenous fluids, supplements of phosphate, sodium, and potassium, insulin. If your blood sugar is too low, you will receive glucagon, intravenous fluid, 50% dextrose solution. That's all about the diabetes in this video. I hope you all liked it. I'll definitely come up with the next video with my another content. Till then, God bless you. Bye bye and take care.